Imagine a 60-year-old man arriving at a Seattle hospital, convinced that his neighbor was poisoning him. His initial symptoms were concerning, but not alarming, until his mental state took a dramatic turn for the worse. This case, detailed in Annals of Internal Medicine, Clinical Cases, https:/10.7326/AIMCC 2024-1260, reveals a rare form of psychosis that may have been inadvertently triggered by health advice from ChatGPT. But here's where it gets controversial. Could a chatbot designed to provide information actually lead to a medical emergency? Psychosis is a mental state where a person becomes disconnected from reality, often experiencing hallucinations or holding on to delusions despite evidence to the contrary. It's not a standalone diagnosis, but a symptom that can arise from various conditions, including schizophrenia, bipolar disorder, and severe depression. It can also be caused by brain injuries, infections, or toxic substances. In this particular case, the man's initial presentation was unusual, but not alarming. He reported that his neighbor was trying to poison him, and his vital signs and physical examination were mostly normal. However, laboratory tests showed some alarming results: extremely high chloride levels, a highly negative anion gap, and severe phosphate deficiency. Despite these findings, he denied using any medications or supplements. As his mental state deteriorated, he began hallucinating and behaving erratically. Doctors placed him on a psychiatric hold and started him on risperidone to manage his symptoms. Further analysis of his blood work suggested a rare condition: bromism. Bromism occurs when bromide, a chemical similar to chloride, accumulates in the body to toxic levels. Historically used in sedatives and other medications, bromide was phased out in the United States by the late 1980s. It is still used in some industrial and cleaning applications. In cases of bromism, bromide can interfere with chloride tests and cause neurological and psychiatric symptoms, ranging from confusion to full-blown psychosis. After consulting with poison control, doctors confirmed that bromism was likely the cause of his symptoms. Once stabilized with fluids and nutritional support, the man revealed a surprising detail. For the past 3 months, he had been replacing regular table salt with sodium bromide. His motivation was nutritional. He believed that eliminating chloride from his diet would improve his health, based on information he had received from ChatGPT. He explained that while experimenting with ways to improve his health, he had asked ChatGPT whether chloride could be replaced. The chatbot suggested bromide as an alternative, without mentioning any health risks or questioning his reasoning. Encouraged by what he interpreted as a scientific endorsement, he purchased sodium bromide online and began consuming it regularly. Medical tests confirmed that his blood bromide level had reached 1,700 milligrams per liter, well above the normal range of 0.9 to 7.3 milligrams per liter. After stopping the supplement and receiving supportive treatment, his psychiatric symptoms gradually subsided. He was weaned off risperidone before discharge and remained stable in follow-up appointments. This unusual incident raises several important points. First, a single case report cannot establish causation. There may have been multiple factors contributing to the man's psychosis, and his exact interaction with ChatGPT remains unverified. The medical team does not have access to the chatbot conversation logs and cannot confirm the exact wording or sequence of messages that led to the decision to consume bromide. Case reports, by nature, describe only one patient's experience. They are not designed to test hypotheses or rule out alternative explanations. In some cases, rare outcomes may simply be coincidental or misunderstood. Without controlled studies or broader surveillance, it is difficult to know how common or uncommon such incidents truly are. Despite their limitations, case reports often serve as early warning signs in medicine. They tend to highlight novel presentations, unexpected side effects, or emerging risks that are not yet widely recognized. Many medical breakthroughs and safety reforms have started with a single unusual case. In this instance, the authors argue that the use of AI-powered chatbots should be considered when evaluating unusual psychiatric presentations, especially when patients are known to seek health advice online. The case also raises broader concerns about the growing role of generative AI in personal health decisions. Chatbots, like ChatGPT, are trained to provide fluent, human-like responses, but they do not understand context, cannot assess user intent, and are not equipped to evaluate medical risk. In this case, the bot may have listed bromide as a chemical analog to chloride, without realizing that a user might interpret that information as a dietary recommendation. The idea that chatbots could contribute to psychosis, https:/post.org/ChatGPT Psychosis. This scientist predicted AI-induced delusions 2 years later. It appears he was right. Once seemed speculative, but recent editorials and anecdotal reports suggest that this may be a real, if rare, phenomenon, especially among individuals with underlying vulnerability. Danish psychiatrist Søren Dinesen Ostergaard was among the first to raise the alarm. In 2023, he published a warning in Schizophrenia Bulletin, suggesting that the cognitive dissonance of interacting with a seemingly intelligent but ultimately mechanical system could destabilize users who already struggle with reality testing. Since then, multiple stories have emerged of individuals who experienced dramatic changes in thinking and behavior after prolonged chatbot use. Some became convinced that they had divine missions, while others believed they were communicating with sentient beings. In one reported case, a man believed he had been chosen by ChatGPT to break a simulated reality. In another, a user's romantic partner came to believe that the chatbot was a spiritual guide and began withdrawing from human relationships. These stories tend to follow a pattern: intense engagement with the chatbot, increasingly eccentric beliefs, and a lack of pushback from the system itself. Critics point out that language models are trained to reward user satisfaction, which can mean agreeing with or amplifying the user's worldview, even when it's distorted or delusional. That dynamic may mimic what psychiatrists call confirmation bias, a known contributor to psychotic thinking. Some developers are exploring ways to detect when a conversation appears to touch on delusional thinking, such as references to secret messages or supernatural identity, and redirect users to professional help. But such systems are still in their infancy, and the commercial incentives for chatbot companies tend to prioritize engagement over safety. The case of the Seattle man is a sobering reminder of how even a seemingly minor substitution, replacing salt with a chemical cousin, can spiral into a medical and psychiatric emergency when guided by decontextualized information. While AI chatbots have potential to support healthcare in structured settings, this report suggests they may also present hidden risks, especially for users who take their advice literally. The study, A Case of Bromism Influenced by Use of Artificial Intelligence, https:/10.7326 AIMCC 2024-1260, was authored by Audrey Eichenberger, Stephen Thielke, and Adam Van Buskirk. What do you think? Could chatbots like ChatGPT inadvertently lead to health risks? Share your thoughts in the comments below.